Okay, good afternoon. Every day, the St. Louis County Department of Public Health is working hard to keep St. Louis County residents healthy and safe. Whether it's inspecting local restaurants before you sit down to eat, or inspecting our community pools, tracking the latest health risk, we're constantly on guard to protect St. Louis County before the health risks turn into something bigger. Today, we're here to share an update on the Cyclospora outbreak in our community. In St. Louis County, we have 106 cases that have been confirmed as of this week. In Missouri, we have over 500 cases this season, which is quite a few more cases than we would expect in the normal year. When an outbreak like this happens, it's a perfect example of why St. Louis County's health department is so important. Our health detectives, our nurses, our food inspectors, our lab technicians are all working together to pinpoint the source of this outbreak so we can keep it from impacting other families. But to keep up with this outbreak, we need your help, and that's why we're here today. If the St. Louis County Health Department calls you, please take that call, or call them right back. All of the conversations with our health investigators are confidential, and a short conversation with you might help us with the exact puzzle piece that we need to pinpoint where this infection is coming from. It can help us protect your neighbors. It can help us track down that important source. So now I'd like to introduce Dr. Kanika Cunningham, the director of our county public health department, who will tell you a little bit about how this impacts your daily routine. Dr. Cunningham.
Thank you, Dr. Page. I'm going to try to set this between the microphones here. Public health is most successful when you never have to think about it. Most people only notice public health during a crisis, but the reality is that our work happens every single day, quietly protecting our community. Every year, our environmental health specialists conduct more than 13,000 food establishment inspections to help ensure that the meals served throughout St. Louis County are safe to eat. They also complete approximately 5,000 swimming pool inspections to prevent waterborne illnesses and protect families throughout the summer. When an outbreak like Cyclospora occurs, those same dedicated teams step up to protect you. Cyclospora is a tiny parasite usually found on fresh produce. It causes prolonged watery diarrhea, abdominal cramping, nausea, fatigue, a loss of appetite. As of today, total case counts are 117. We had 11 new that came overnight, so Dr. Page was not aware of that. Our team has interviewed more than 90 people and have actually contacted all 106 cases as of this morning. Each interview gives us vital clues about shared grocery stores, suppliers, or restaurant meals. We know that 81 of these cases did not report any international travel, and 73 people reported eating lettuce. At the same time, our environmental health teams are engaging local farms, distributors, and restaurants to reinforce safe food handling practices and conducting our recall operations in which we visit each store to remove the lettuce that has been recalled. We're also providing updated guidance and best practices to food service establishments across St. Louis County during this outbreak. This investigation extends beyond county lines. We're coordinating closely with the Missouri Department of Health and Senior Services, the Centers for Disease Control and Prevention, the Food and Drug Administration to compare findings and identify any broader patterns. Foodborne illness investigations often cross county and state lines, and these partnerships are essential to identifying a common source if one exists. For the community, I want you to know there are practical steps you can take to protect yourself. Wash your produce thoroughly. Wash all fresh fruits and vegetables under running water, even if the package says pre-washed. Wash your hands with soap and water before preparing food, before eating, and after using the restroom. Consider cooked foods. If you want to take extra precautions while out eating, choosing cooked vegetables or hot meals will reduce your risk. Know the symptoms. So if you have watery diarrhea that lasts for more than a couple of days, also experiencing stomach cramps or fatigue or nausea, please contact your doctor right away. And I will encourage everyone during this time to buy produce from your local farms and markets while this investigation is taking place. I'll now like to introduce one of our epidemiologists who's leading this investigation, Dr. Brodowski, who will explain how this work comes together for the county.
Hello. People often picture disease investigations as being driven entirely by computers or laboratory testing. Technology certainly helps, but outbreak investigations still rely on classic epidemiology. We interview people individually, we compare timelines, we review where people shopped, what they ate, where they traveled, and what experiences they may have shared with others. It's a bit like putting together a puzzle. One person's grocery store purchase or restaurant visit may not seem significant on its own, but when we compare dozens of interviews, important patterns begin to emerge. That's why answering our calls is so important. As of today, we've completed interviews with about 87% of the cases that have been reported to us. We're grateful to everyone who has taken the time to speak with us, but we still need to hear from others. Our goal isn't to blame anyone or investigate individuals. Our goal is to identify the source of illness as quickly as possible so we can stop additional people from getting sick. As our investigation progresses, we'll continue sharing confirmed information with the public and with our partners. When we identify actionable findings, we'll communicate them promptly to help protect consumers and maintain confidence in our local food system.
Thank you, Amanda. So to recap, whenever there's an announcement in a community about a foodborne illness, people naturally have questions. What can I buy at the grocery store, and where can I take my family safely for dinner? I'm here also today to let everyone know that the St. Louis County Health Department is on the job. From the thousands of inspections that we perform every year to the ongoing investigative work currently to track Cyclospora in our community, our nurses, our health detectives, our food inspectors, our lab technicians, they are on the job to protect the water supply and the food supply in St. Louis County. But you can also help. You can help by washing your fresh vegetables. You can help by answering the phone when a health investigator from St. Louis County calls. You can help by listening to your body if you don't feel well. And thank you again for sharing this information with the community. This is an important update, and we'd certainly be glad to answer any questions.
I think a lot of people are wondering, we first heard about this a month ago, and we kind of gotten updates from multiple different health agencies, like up to the CDC and Pittsburgh. What is taking so long to find the source of this, especially when you're seeing so many people who are being sick?
I have some ideas, but we have some experts here that can give you a more specific answer. You want to take that?
Sure.
I could get very technical here, and I'm not going to do that. You know me, I can get very technical here. There are a lot of factors that are playing into this. And I wouldn't say that we have not identified a source. We have signals that we know are pointing towards something. But in order to point back to a specific farm, a specific growth lot, or something like that, we need some information that we don't have and we sometimes can't get. And a lot of that happens because of bigger changes at the federal level that are way outside my wheelhouse, but the classic epidemiology of this doesn't change. So when we interview people and we find out that 94% of the people that we interviewed reported eating lettuce, that tells us something. Of course, we compare that to the proportion of people in the population who also report eating lettuce. But when we hear that 75% of the people we interview ate at Taco Bell, that tells us something. 75% of the population didn't eat at Taco Bell in that 10-day period before, So we do have an idea of what's causing it, but because of bigger picture systemic problems, that's why they haven't necessarily been able to point it back to a specific field or farm. And a lot of times we never get the answer about the food product itself. The food testing isn't as important as interviewing the people.
When you say systemic issues, are you talking about money, staffing?
probably all of those things that are way above my head that go all the way up to the federal level. There are even, Cyclospora used to be part of the FoodNet, PulseNet system. It's not anymore. That was a decision made at the federal level for whatever reason they had at the time, but yeah, it's a big picture problem, but it's not that we don't know anything. Every interview we get is still pointing us in the right direction.
And I believe also there was a delay on the federal level, about a 6-week delay with getting information down to local public health agencies. So I think that's another systemic barrier that we were directly impacted by as well.
Michigan was out there putting out great information. Their state health department was putting out great information. We didn't see our cases as early as everybody else did. We started seeing our cases that last week in June. And like we talked about before, we get to interview our cases very quickly. So we could start investigating and asking those questions right away. We also have some usual suspects with Cyclospora that we can always focus on. And at the beginning of this, we were seeing a lot more international travel than we are later. So that was kind of where our eyes were for the first handful of cases we had.
What sort of questions do you ask people when you do this questionnaire?
That's a great question. The Cyclospora questionnaire is very specific. It's a question that's developed by CDC. It's called one of the National Hypothesis Generating Questionnaires. And the one for Cyclospora focuses very heavily on consumption of fresh fruits, vegetables, herbs, things like that are eaten during the 2 to 10 days before someone got sick. So we ask the person when they got sick, what their symptoms were, and then we backtrack from there, ask them things like, where did you get your groceries? What restaurants did you eat at? And then we go through this very long laundry list of several dozen specific foods, and they'll tell us if they ate those or not fresh during that time period.
Is Cyclospora something we see in the summer months?
Yes, Cyclospora is very, very seasonal. You can occasionally see it off season if someone has traveled to another country, usually a tropical country where they were exposed while they were abroad, but we almost exclusively see it in the summertime months. It's also a kind of illness where sometimes in one year we may see just a handful of cases, and then the next year we might see 25, and the year after that we might only see 3. This is the biggest outbreak that we've ever had here in St. Louis, but it's a seasonal, very outbreak-driven type of parasite.
The people who are going to get questioned, is it going to be people who are sick, or is it going to be like people who are around people who are sick, or people who are in certain restaurants, something like that?
The way that we get our cases is because someone has gone to a doctor, they've collected a specimen, and they've tested the specimen, and the specimen tested positive for Cyclospora. It's a reportable condition in Missouri, so it's automatically reported to the state or local health department. When we get that positive lab test, we reach out to that person that day. Typically, they know something's up because they've been sick for a while, and then we ask them this series of questions. We do ask them if anybody around them has also been sick and has had similar exposures in your travel party or household, and if so, then we interview that person too.
Have your interviews given you any sense of what's behind this? Like, have they coalesced around any suspect?
Lettuce.
Lettuce? Okay.
Lots of Taco Bell, lots of lettuce, and this is not a blame. This is just a fact.
So that's something that you've seen in your own investigation?
Yes, we've absolutely seen that. And fresh produce, and in particular leafy greens, while very healthy and delicious, are often contaminated with various different illnesses and are a common source, especially for something like this.
Is it still just iceberg lettuce, or are we talking all lettuces right now?
It has been largely iceberg lettuce, but I'm not sure if it's going to grow beyond that. We're also starting to see that not nationwide, not all cases might be tied to this one big outbreak. We may have other smaller outbreaks in different places. Whether or not we have cases that are tied to others, that's why we don't just ask people about lettuce. That's why we ask people that whole big list of fruits and vegetables, so that if it finds out we're tied to cilantro or we're tied to raspberries, we would also have that information, and maybe we could link that up to other people in the country too.
Lettuce have like a really short shelf life, and so is it possible that this outbreak has burned itself out? And have you seen any indication that cases are going down?
I am not familiar with the food side of this, but in order for the outbreak to have burned itself out, we need to have no more contamination at the source. So if there was an ongoing source of contamination in a field, then we would need to end that contamination. We can also remove all of those potentially contaminated products from the shelves, and we have education to people about what to buy, how to cook things. So hopefully this is something that is going to end in a timely manner. I can say on behalf of our investigative team, we are still seeing very large numbers of cases coming in every day. We hope that will end soon.
I think part of it, if I can also respond to that. So by the time someone consumed the contaminated lettuce, it's about 7 days for them to develop symptoms. So now we're seeing this peak. I do think maybe over the next few weeks, we're going to see a rise. And then we'll possibly see this level off. The other thing with our department, the CDC put out a few different brands of lettuces that was recalled. So the additional locations were Walmart and Sam's. So we did go and remove those bags of lettuce from those establishments. If by any chance those were contaminated and somebody consumed that, let's say 2 weeks ago or a week ago, it's likely they will be coming up in the next 7 days or so, showing signs or symptoms. So I think we may see an increase before you see a level off.
That's a really good point. So it's there's an incubation period of 2 to 10 days, typically about 7 days. On top of that, someone's usually sick for a couple days before they feel sick enough to go to the doctor. Then they have to collect their specimen. Then it has to grow or result. So there is a lag. I know, you guys. This is my bread and butter, so I forget that it's really unpleasant. I have seen some stories about other states that have had specific products, herbs, things that they've identified. We don't have enough data locally to see if any of our cases are tied to those bigger picture, small outbreaks.
So given the cuts on the federal level and the changes in how they do, how more important is local spending?
Well, if you ask me. Local epidemiology, local food inspections are always going to be the heart of keeping everyone's community safe. We can't do that without things at the federal level, things at the state level, things at the county level. But what we do is going to stay the same, and we're going to do the best job that we can to keep everybody safe, no matter what goes on at the federal level or anywhere else.
If someone's infected, is there a risk for transmission? And then also, what is what's there? Is this a life-threatening condition?
Good question, Tracy. It is possible to spread Cyclospora person to person, but it's rare. The most common way that this is transmitted is when fresh produce is contaminated by sewage. So we always encourage people to wash their hands. That is a general statement, not just when you're sick. But if you're sick, be extra careful about it. Maybe don't prepare food for others until you're feeling better. All of those common sense measures, but we don't typically see it. And that's why we're not seeing secondary cases within households. If we do see multiple cases in the household, it's usually because they were exposed together. And I can't remember what the second part of your question was.
Is this a life-threatening?
Anything can be life-threatening depending on your underlying medical conditions and how you handle things. The biggest risk that we're seeing on average, generally speaking, would be somebody becoming too dehydrated. Generally speaking, we do not see the kinds of severe complications with Cyclospora that you would see with, for example, E. coli 0157, where there's a risk of a very serious kidney complication. This does not happen, but that's not to say that somebody who is immunocompromised and who is not able to get the fluids that they need to stay hydrated, those people could end up hospitalized.
And does this resolve without medical intervention?
It can, and it often does. However, there is an antibiotic that is used to treat this. And so if you are sick, this is why we're recommending that people go to see their doctor if they're sick for more than a couple of days, and your doctor can talk with you about whether or not it's appropriate for you to get that antibiotic prescribed.
Just kind of a little bit more about the severity of it. How long would this thing keep you down? You can't go anywhere. You know what I'm saying? How long?
Do you want me to keep going? I feel like
I think you're doing great.
It can be a while. So we have talked to people who are sick for several weeks. And a lot of people tough it out. They don't go to the doctor and they're just really miserable for 14, 16 days. And then they finally go to the doctor, they get their diagnosis, and often they're able to get that antibiotic that helps them. Some people are sick for a shorter period of time, but this is not one that's going to give you 1 or 2 days. This is a longer one.
So you were talking about the places that you've actually gone in and taken their stuff off the shelf. But, is it all stuff that's bagged lettuce, or can I go and feel safe claiming something off shelf in Schnucks or whatever.
No, this one.
I can do that one. So now, given that we have removed all of the bags of lettuce that was recalled, it is safer, but I do recommend to still wash it. Purchasing the heads of lettuce instead of the packaged lettuce right now. Again, the investigation is ongoing. We're still seeing outbreaks across the country. So I would still recommend either buy from a local farm, a local market, or if you do need to go to a larger grocery store chain to buy the heads of lettuce. And when you get home, still continue to wash that lettuce under good running water or any fresh fruit or vegetable that you buy at this time.
But also, unfortunately, their season was ending this month. They're pretty much out of lettuce. It doesn't grow anymore, so that's a little bit unfortunate.
Yeah.
When you do investigations and you are learning all this stuff, where does it go after you figure it out? Like, who do you give it to, and who do they give it to? How long does it take to get all the way to the CDC?
When we do these investigations, they are confidential. And then we enter that information into the state's electronic communicable disease surveillance system. It's called Show Me World Care. So as soon as we can get that information entered, and we try to do it quickly, but we've got a lot of cases coming in, we enter that. We also have that form, and we attach the form. And then the state health department, through some magic technology, gets that information from what we enter into our system. They get it into the system that feeds up to CDC. So it's all dependent on each step, but as long as we can get that information into the system, it can get up to CDC relatively quickly.
How many people do you have, like, calling people and interviewing? Because I understand it's a pretty involved process, right?
It is long, but it is fairly straightforward. So typically our investigation team, we have 3 investigators that I work with, and then we have someone who specifically works with schools and daycare centers. So that whole team has been handling this, but we've been getting some big assists from some of the other teams, our epidemiologists who don't usually do the actual calling on the phone, and they are doing that with us now. So we're kind of trying to bring in additional people, because one thing that we didn't mention is, because people see this in the news, when they have their diarrhea, they're following our guidance and they're going out and getting tested. So we're not only seeing a bunch of Cyclospora cases, but we're also seeing a rise in other GI illnesses: Salmonella, E. coli, Yersinia, Campy, whatever those are. So on top of all of these Cyclospora cases, we're also having all of these other enterics. And so we're trying to find people that can do all of those, but we've been putting in a lot of work.
Okay. The first question we heard was about the defunding of federal resources and the impact it had on getting started on this outbreak. And I think it's important to recognize that a budget at the federal level or the local level, a budget is a reflection of your values. It's a yearly statement on how you're going to use your resources. And at the federal level, we've seen a shift away from public health. And when public health is underfunded or disinvested, then it slows down a response to challenges like this. And you don't really feel the good work that the Department of Public Health is doing, thousands of restaurant inspections and community pool inspections. You don't really feel that unless there's a problem. And that's why it's so important that here at the local level, especially with the cuts at the federal level, it's so important here at the local level that we maintain an appropriate funding for our Department of Public Health. Any other questions?
Berkeley, we do have a question unrelated to the topic. A couple of reporters wanting to get your thoughts on Panera's relocation from St. Louis to Boston.
Well, Panera is a great St. Louis story. The St. Louis Bread Company started here 40 years ago as a startup. And a lot of people in St. Louis may not know that St. Louis is one of our strengths is our startup community. We have more startups than most places in the Midwest and most places in the country. In fact, we're #1 for minority-owned startup success in the country. So first of all, St. Louis Bread Company becoming Panera and becoming a billion-dollar enterprise is a St. Louis story that we should be proud of. We would all hope that our St. Louis startups that become billion-dollar enterprises could keep their headquarters in St. Louis, but sometimes They become acquired and they move. And that's happened before in our history. But Panera St. Louis Bread Company has left a big footprint in our region. There are a lot of people working today that wouldn't have a job if there wasn't a Panera, or they'd be working somewhere else. And a lot of us get services from Panera on a regular basis, and they'll still be here. So even though we lose their headquarters, they will have a lasting impression on our region, and we're proud of that. And it's a great St. Louis success story that we should be proud of as well.
I have two questions from Mark Maxwell,
Ha!
which I will read verbatim from my phone. What did you make of the county council's committee of the whole yesterday? They essentially said if voters don't pass Prop U, all these bad things would happen. Why is it okay for them to say those things in a public meeting, but not okay for you to print them on a mailer?
Mark Maxwell, hello. You always have a complex question, and I'll do my best to answer. It is okay. Everything we did almost 2 years ago was approved by our attorneys, and there's nothing wrong with it. It is an example of selective prosecution that you have identified in the past, and so have most people in our community. The county council yesterday mentioned the use tax that's on the ballot on Tuesday and how important it is that that passes in St. Louis County. We have a fundamental structural problem with our budget in St. Louis County that's been there for 15 years. And we have cobbled our way through it with one-time funds, Proposition P for public safety, the NFL settlement funds, COVID relief funds, ARPA funds, and we've gotten by. A budget is your values. It is your statement of what's important to you: public safety, public health, roads and bridges. And most people do a budget on an annual basis. Most governments at the state and federal level do a budget on an annual basis. This process that we've adopted from the county council this year of intermittent budgeting, intermittent government shutdowns, is something you see in Washington from time to time, but no one else does this. A monthly budget allowance doesn't work in government, and that's why we're struggling. But the fundamental root cause of all of this isn't a misguided strategy of monthly budget allowances that no one does. The fundamental problem is our budget is structurally broken in St. Louis County and has been for 15 years. And this is primarily because of our deep investment in public safety. St. Louis County, we believe in funding our police department, and we have done that. And the vast majority of our budget deficit, most of it, is because we have made a big investment in public safety and our police officer salaries and our police cars, and everything we buy in government has gone up, just like at home for you. Gas costs more, salaries are more, cars are more, everything is more. And if we're going to continue to have first-class public safety, first-class police department in St. Louis County, we do. We have the best police department in the Midwest, and we need to maintain that investment. Our choices are to cut police officers or to raise revenue. There is no other path because most 2/3 of our budget is public safety and over half of it is our police department. There will be no significant cuts in our budget without cutting public safety. So the county council, when we agree on stuff, you usually don't hear about it. Conflict is news, agreement is not. And we agree that we need a use tax. We need to fix our structural problem in our budget, and the use tax is the best way to do it. That's what most local governments have done. That's what the state has done. It's what's done across the country, and we need to do it in St. Louis County so we can close this gap and we can maintain our traditional, significant, and rational investment in public safety. We're not going to cut public health. Gutting public health is a really bad idea. Every once in a while when people talk about how we should do that, then we have something like Cyclospora to remind us why it's a bad idea. We need a bigger investment in roads and bridges, and there's nowhere else in county government that's rational to cut. We've cut to the bone. We've reduced hours. We've closed our offices on Friday. We closed 2 pools. We canceled our fireworks. We're making significant cuts, and until we cut, and I hope we never do, I hope the next county council and the next county executive doesn't cut public safety, because that's the only place left to cut, and that's wrong.
And it's not a Mark question if it's not a follow-up. Why haven't we seen more activity from you or your campaign on this property question? Wasn't this your push?
Well, I believe that Prop U should pass, and we can always do more. We have a lot of complex questions in St. Louis County, a lot of things we are attending to. We have a broken budget. We have to take care of people in the jail who need their health care. There are other budget pieces that are broken. I'm spending a lot of my time talking about that, but I have been speaking on Prop U. I could always do more, and everyone can do more, and I accept that. Prop U needs to pass.
Anyone else?
Thank you.